Hi, welcome to Mondays with the Midwife. I'm Regina Kaiser, certified nurse midwife, doctor of nursing practice, and co-owner of Breathe Birth and Wellness. On this evening's episode of Monday with the Midwife, we're going to continue our discussion from last week over natural induction of labor. I have two more topics I'd like to cover. One of those is the use of evening primrose oil. I'm often asked what my thoughts are on it and do I recommend its use. One of the things I like to consider when I recommend a treatment is there any evidence showing that this is safe and effective for use in pregnancy? And unfortunately, I found when I looked for the information on evening primrose oil, there's not a lot of studies that support the safety and efficacy. I did find a few, but they're very small scaled, and I'll just discuss those with you real quickly. In 1999, there was a study on comparing 54 women receiving evening primrose oil the last 3 weeks of from 37 weeks on until delivery, and then 54 that did not receive it. And what they found was that the group that utilized the evening primrose oil, when you compared the two, there wasn't a huge difference. There wasn't any difference really in the length of their labor and the length of their pregnancy. However, the group that utilized the evening primrose oil, they found actually that they had longer length of the active labor, and they had a longer time frame of their water being broken. They also noticed that in this group, there was a trend for the fetal head not to descend into the pelvis without more intervention. So this group actually ended up requiring more use of oxytocin to stimulate their labor. When you look at another study in 2006, with 71 women either assigned to receiving the evening primrose oil or the placebo, what they found was that the women that got the evening primrose oil actually entered labor with a more favorable cervix. They had a better Bishop's score overall, and that 70% of those women had a vaginal delivery compared to 50% in the group the ones that did not receive the evening primrose oil. So if you compare these two studies, you get two completely different pictures. And the problem with both these studies is that the study sample sizes were very small. So it's very hard to make an educated decision based off of the size of the samples. When you compare one where you're requiring a whole lot more intervention for the evening primrose oil group, and then the second one where they actually had a more favorable cervix and ended up with a vaginal delivery. So if you're considering using evening primrose oil, just be aware that there's very little scientific evidence that's been recorded that supports the effectiveness, and in some cases, some evidence has shown that it can be harmful in that it requires you to have more intervention. So when someone has recommended the use of evening primrose oil, it's based more off of anecdotal treatment, which is just based off of personal testimony and trial and error. The second thing I want to talk about tonight is castor oil. Castor oil is another method that's been widely utilized for women for a very long time to stimulate labor. When you look at studies on castor oil, it does show that it does stimulate labor contractions. It's made from the castor bean plant, and actually it's 90% ribonucleic acid, and it's thought to work by binding with prostaglandin receptors and causes the smooth muscle to contract, specifically that of the GI tract and uterus. So one of the things with castor oil is that while it works to contract your uterus, it also contracts your GI tract and causes pretty moderate GI distress for a lot of women, which can lead to nausea, vomiting, diarrhea, and in some cases, dehydration. So if you're using castor oil, you have a higher risk of becoming dehydrated and having possibly a dysfunctional labor pattern as a result of that dehydration. So while it is not very pleasant from a GI standpoint, it can cause contractions. So it has been shown to require less oxytocin augmentation when utilized. For a more in-depth review on induction of labor using castor oil, you can look at evidencebase.com and visit Rebecca Decker, who has done a more in-depth study on both of these methods of induction of labor. Next week on Monday with the Midwife, we'll talk about the rights of childbearing women. And one thing I would like for you to keep in mind as the season's upon us, this weekend at Breathe, Breath, and Wellness, we have Santa Claus coming for a visit. So if you have a little one that hasn't had a chance to visit with Santa, would like to get some pictures made or come and just give your Christmas wish list to Santa Claus, come by and see us on December 16th from 2 to 4 o'clock and tour our facility and enjoy some arts and crafts with your kiddos. We hope to see you then. Bye.